Good morning. Today I will elaborate a very important topic in pediatrics, that is necrotizing enterocolitis. We all have studied this topic in final year for the university exams, but still we are not over this and we do not understand it by heart. So today I will explain it in simple way. Necrotizing enterocolitis. How does it occur? How does it develop? That is, what is the pathogenesis? First of all, I will explain the pathogenesis. What are the factors which lead to necrotizing enterocolitis? The basic two factors are, first, that is vasoconstriction. Vasoconstriction can be also due to the maternal cocaine use. Next is the bacterial colonization, and further which leads to necrosis. When there is necrosis, there is bleeding within the lumen of the intestine, and there is bleeding, and that lead to distension of the abdomen. And all these presents as symptoms when the baby have necrotizing enterocolitis. And the most important factor of vasoconstriction is prematurity. Baby less than 28 weeks. Okay. Next, we'll have to study its symptoms. First symptom, that baby will have abdominal distension, baby will cry excessively, and he may have the fever or the features of the sepsis altogether. And it has been simplified in a very simple way by Bell staging. Bell staging categorize the symptoms into three classes: stage 1, stage 2, stage 3. Stage 1, when there is necrosis and bleeding, and it has further two parts, part A, part B. When there is bleeding, that leads to abdominal distension, decreased bowel sounds. And stage 2, when there is necrosis, there is entry of air from within the lumen into the wall of the intestine, then it is called as pneumointestinalis. And if it leaks out into the adjacent blood vessels like the portal veins, it is called as the pneumoportalis. Similarly, when the entry pathway also acquires the bacteria, it colonizes the peritoneum, it can lead to peritonitis, it can lead to ascites, and it can also lead to pneumoperitoneum, that is air under the diaphragm, that is stage 3B. And the treatment of necrotizing enterocolitis, it is divided into two parts. First, basic, we have to do the medical management of the baby. First, we have to maintain the baby at nil per oral, and then give the medical management by prescribing the major or the commonly used broad spectrum antibiotics like cefixime, cefotaxime, or you can also give the azithromycin. Next, if the baby is not stable, or if the baby is unstable, he is very grave, he is becoming very serious, then we can proceed for the surgery depending upon the severity. In surgery we can do two things. First, for peritonitis we can do, or ascites, we can do the peritoneal lavage. And for pneumomediastinum, for pneumoperitoneum, the air under diaphragm, which can lead to severe other feature like cardiorespiratory arrest also. So we have to do the surgical laparotomy and evacuate the air, and the area of necrosis should be excised and sutured. That's it. Thank you.